My name is Dr. Marlain Mubarak. I'm a consultant gynecologist trained in Oxford. Today we are going to talk about menopause and hormone replacement treatment. It comes a time in a woman's life when the period stops, and usually at the age of 51, that's the average age of menopause. However, some women, their period stops well earlier, under the age of 45, and we call it premature menopause. They suffer with multiple symptoms, including hot flushes, night sweats. These symptoms can even appear before the period stops. That includes, waking up in the middle of the night, drenching with sweat, throwing the duvet, loss of memory, unable to concentrate and focus, being irritable, unable to sleep. In addition to all these symptoms, which usually disappear in most of the women, however, 25% of the women would still continue to have the hot flushes and night sweats. There is as well the risk of osteoporosis once the period stops. Premature menopause is when the period stops under the age of 45, usually if the ovaries were removed for surgery or genetically, or because the woman had some chemoradiation. The risk of menopause, especially the early menopause under the age of 45, in addition to the affecting the quality of life of the woman, is the risk of osteoporosis, bone fracture, the risk of having vaginal dryness, repeated urine infection, repeated vaginal infection, affecting intimacy, especially with early menopause, heart disease, heart attacks, and these are some of the problems that is associated with menopause and early menopause. When we are managing menopause, there are several options for women, including using hormone replacement treatment or HRT. HRT had been associated with bad reputation. However, it's really safe. It makes a big difference to women's life, to the quality of life. It improves the hot flushes. It improves the anxiety, the quality of the sleep, the memory, the focusing. As well, it improves the risk of osteoporosis and decrease the risk significantly. So what happens during the menopause? The ovary stops working, and there is a very low level of estrogen, which is mainly produced by the ovaries. Hormone replacement treatment basically is replacing the lack of estrogen. We use a combination of estrogen and progesterone. In certain situations, we use just estrogen only, especially in women who had a hysterectomy. It comes in different shapes and forms. It comes as a tablet. Some women can still have their period if they wish to. It comes as well as a gel, which can be rubbed on the skin as well, especially if there is vaginal dryness. We use vaginal tablets in the form of tiny tablets we put inside the vagina, or vaginal creams. So there is a different way of administering the hormone replacement treatment. It all depends on the woman, her age, and what we are trying to achieve. Once a woman starts hormonal replacement treatment, we normally choose the HRT with the lowest dose of estrogen, as there is less risk associated with that. It's very quickly, within a week or so, the woman starts feeling better. And if she's still having symptoms, then we can increase the dose of estrogen to give her the desired effect. And it really works. Some women like to use alternative treatment to hormone replacement treatment. However, lifestyle changes such as diet, exercising, especially weight-bearing exercising, yoga, can help in addition to HRT. But alternative treatment can also include herbal medications such as sage, black gosh, We need to be careful with these herbal treatments because they are not regulated, and we need to make sure that we use a herbal treatment that there is evidence for it and comes from a certified source.